with the conversation taking place around the real possibility of the Affordable Care Act or Obamacare being eliminated. Now we have an opportunity to bring back into the conversation this very important question of whether or not we're going to have true universal health care, a healthcare system that really addresses the objective needs of all of the people here in this country. So, Dr. Flowers, thank you so much for joining us this evening.
Thank you for having me, Ajamu, and please call me Margaret.
Yeah, okay. You know, I'm from the South, so we're very formal about this kind of thing.
Okay, whatever is comfortable.
Okay. Well, yeah, Margaret, thank you again. Now, you are part of a very important relatively new organization, the Health Over Profit for Everyone, which is a coalition of physicians and advocates who are taking advantage of this moment to, in fact, spearhead once again this conversation around universal health care. Before we get into specifically what the campaign is all about, kind of set us up in terms of where are we at right now with the conversation around healthcare and the Affordable Care Act.
Sure. Well, once again, as it was in 2008 to 2010, national healthcare is back on the political radar. We're 7 years in, almost 7 years into the Affordable Care Act, as it was called, and we're seeing the failures that we knew were inherent in it. That it was not a law that addressed the root causes of the healthcare crisis in this country, and so we've seen that the number of people who have gained coverage has plateaued. It's not expected to increase even if the Affordable Care Act stays in place. The cost of health insurance premiums and out-of-pocket costs are rising. Families are not able to pay those upfront costs, and so they're struggling to afford the health care that they need. So we already know that the Affordable Care Act is costs are rising and people are struggling, and there are gross inequities. The Republicans are calling for a repeal of the Affordable Care Act, as they have since the beginning, but now they're actually starting to recognize that, oh, this is actually happening and people are going to lose coverage. And so there's a little bit of panic in the Republicans, but what they're putting forward is actually going to drive our country into more of a privatized system. It was already moving in that direction under the Affordable Care Act. We've seen a greater consolidation and privatization of not just our private insurances in our hospitals, but also of our public insurances being privatized. And what the Republicans want to do is kind of make that happen completely. So it's a non-solution, and the crisis is going to continue. And this has opened up a large political space where, once again, it's on the national radar, and we can push again for the solution that we really need: national improved Medicare for all.
Talk to us a little bit about what that really means. The term national improved Medicare for all. What does that entail? What are some of the characteristics of that kind of system?
Right, so it's a national system, so it's nationwide. Everybody is in it, no matter where they are in the country. It's like traditional Medicare in that we pay for it upfront through our taxes. So it would be actually create a progressive financing mechanism. In the United States right now, we're one of I think we were ranked 54th in the world for the fairness of our financing. It's a very unfair system where those with lower incomes pay a higher percentage of their income for healthcare. So we have to reverse that. And so it'll be paid up front, no premiums, no copays, no deductibles. When somebody has a health problem, all they need to do is think about where they're going to go to get their care, not whether they have the cash to pay a copay or if they're going to go into financial ruin. And then we say improved because our traditional Medicare is not comprehensive enough. Every single person needs to have what we consider to be all medically necessary care. Mental health, vision, hearing, dental, all of your medical needs, your pharmaceutical needs, medical devices, home care, and even including long-term care, all would be covered in this single system. And so it'd be
everyone would be covered, correctly? Everyone from birth to death.
Absolutely, absolutely everyone, and it's important that it's everyone, including people who haven't gotten their documents yet. Every person living within the United States would be in that system. I've lost you, Ajamu. I can't hear. There we go. Now you're back.
Hello?
Yes, now you're back. Okay. Yes, every single person would be in the system. Whether they've gotten their documents or not, it's important that every single person is able to get the care when they need it.
Great, great. So now we know that we have a political issue here, of course, even though it's been clear that there's been a popular base for Medicare for all. We have right now a struggle. You have Democrats who are pushing for retaining the Affordable Care Act. You have groups like yourself that say we need to move beyond that. Where should we as an activist community be, and what are some of the real challenges that we have to overcome in order to make this a reality?
Mm-hmm. Well, this is, the typical struggle that we always face, where the reason that we don't have a national improved Medicare for all, because it works. It's worked all around the world. It's not a question of whether this works or not. We know that even if we looked at our own health systems in this country and looked at our traditional Medicare versus the privatized system, that traditional Medicare is better. We know that the crisis that we're facing, the healthcare crisis, is not going to go away until we solve it. So the one factor here that we can change is the political will of our legislators. And that is something that we can change as people when we organize, when we're strategic in our action. We need to build a broad base of support for it. And actually, we have a strong base to build off of, because already majorities of people in the United States support this approach. I think it's more of people understanding and recognizing that if we work together and combine our strengths, we can actually win. And then we need to think about pressuring in a strategic way our members of Congress and exposing the corruption of the industries that pay our members of Congress so that they can continue to profit, that raise the prices of medications, that give people health insurance or sell people health insurance that doesn't meet their needs. We have to expose that gross corruption.
In this improved Medicare for all, what would be the role of private insurance companies?
They would be gone. We don't need private insurance companies. They actually don't add anything to our system. They take away from our system, because the vast majority of private insurance companies are investor owned. Their responsibility is to make as much money as possible. They do that by charging as much as they can for premiums, shifting as much of the cost as they can to patients through upfront copays and deductibles, and then trying to get away with not paying for care if they can do that. So that's the wrong model. That doesn't serve health, it serves profit. And that's why we need a system where the bottom line is health.
How do we explain the fact that we have not gotten more traction, on this issue? That during the debate around the healthcare reform, there seemed to be majorities of people who wanted something radically different than what we ended up with the Affordable Care Act. Mm-hmm. And even now, we know that a large percentage, something like 74% of all of the Democrats who make $30,000 a year and under, say that the government should be responsible for providing some kind of healthcare system. And interestingly enough, even among Republicans, making $30,000 and below, those vaunted working class folks, 52% believe that the government, in fact, has a responsibility to provide some type of health care. So how do we explain the fact that the U.S. is the only, of all the advanced industrialized capitalist countries, the only one without universal health care, when clearly majorities of people seem to want it here in this country?
Well, I mean, it's a crisis of democracy, right? Here you have something that the people need, something that they want, a proven solution, and yet our lawmakers are, because of the influence of the industries that are profiting off of this system, are unable to, go forward with this approach. And so that's why it's really imperative that we undertake this, to put this on the table, so to speak, and then make sure that it gets passed. And this is something that we can do, as people. We do have the power to influence our lawmakers and make that happen. And it's the only way that it's going to happen is if we do it. I think one of the lessons I took out of the last reform process that I was very involved in trying to push for a national improved Medicare for all then, is the acronym ICU. So we have to be independent in political party. We do not tie our agenda to the agendas of the members of Congress. We need to stay true to our issue. We need to be very clear about what works and what doesn't work, because they're going to tell us, oh, well, we'll do this and that'll be great. We have to understand whether that's actually going to solve the problem or not. So we have to be informed. And then uncompromising. You know, we're so often told in politics that it's a game of compromise, but that's actually taking away our power. We can't compromise on fundamentals like healthcare. We have to go for the real solution that's going to solve the crisis. So if people can internalize and understand that, being independent, clear, and uncompromising in our demand, then we will win.
Okay. Well, you know, Margaret, we're going to now move toward the audience. We have a number of questions for you on this issue. Quinn wants to know, how do we push for a single payer when the administration is dismantling the Affordable Care Act?
Well, that opens up a major political space for us to be pushing for it, because the Republicans don't really have a solution. So the people need to put forward that solution. And let's remember that it wasn't on the table when the Democrats were there either. So it's not about political party, it's about what the movement does.
Julianne Ward is asking, is it a fact that Bernie debating Cruz about the Affordable Care Act, is that either helpful or harmful to the universal health care issue? Where's Bernie Sanders on this issue?
So Senator Sanders has been a longtime advocate for a single payer system, but right now, because the Democrats are in the minority, they're really rallying, all very focusing on saving the Affordable Care Act. And so Senator Sanders is actually not introducing, or saying he won't introduce, his single payer bill this session. I think that he is telling people, we'll save the Affordable Care Act now and work for Medicare for all later. That's the wrong solution. We need to be just saying, no, now is the time to solve the crisis.
You know, Margaret, let's just kind of look at some of these terms, because we got a question from Tina, and she asks, is Medicare for all a way to have single payer? Let's get that clear.
Right. So single payer refers to, and single payer and Medicare for all are basically the same thing. But single payer is confusing to a lot of people. They don't understand that it means that we all pay into one public system and it's there for us. And so we often use the term Medicare for all because many people understand what Medicare is.
So is that a better term to use? Like, I kind of agree with, you know, when you start talking about Medicare for all and single payer, that it seems like people understand much better when you just leave it simple and talk about Medicare for all.
Right, and actually the polling shows that Medicare for all polls higher than single payer, because again, so many people don't know what single payer means.
And that's even more relevant for what you all are pushing, because I guess, you know, the single payer component is related to Medicare as it is now, and the still role of private insurance companies. But if you eliminate the private insurance companies, you know, that basically with this improved Medicare for all, you don't have single payer, right?
Well, single payer really refers to just the financing mechanism. And so I think what you're saying is when we use the term Medicare for all, what we're really talking about is creating a healthcare system. So it's a comprehensive system where we can look at what the needs of our population is, make sure that we have health facilities for all communities to have access to. Really allows us to create a whole system that can negotiate for better prices for drugs, for services. So single payer is just really financing, and a Medicare for all is a comprehensive universal healthcare system.
Pete Sounds says that the Affordable Care Act is a gift to the insurance industry. Is that correct?
Very wise. Yes, it was a huge, I mean, Ajamu, I know you talk often about neoliberalism, and I'm sure many of your listeners understand what that is, but basically this was a huge shift of public dollars right into the pockets of the private insurance industry.
Mm-hmm. Al Jensen says, has the question, Dr. Flowers, when you are president in 2020, will you put in motion single payer healthcare?
Well, thank you very much. This is definitely a top issue for me. I'm a pediatrician. That's how I got into this fight, you know, being in the healthcare system and seeing that it wasn't about health. And I think that whoever is president in 2020, this is our goal, is to make a national improved Medicare for all system the only politically feasible solution by 2020.
Lindsay wants to know what kind of support what kind of support does this push for Medicare for all or single payer have among healthcare professionals?
You know, it's interesting. There was a poll done in 2002 and then repeated in 2007 nationally of physicians, and there was a 10% increase in just that 5-year period, so that 59% of health professionals in 2007 supported a national improved Medicare for all. I've been doing lectures at hospitals for the last 10 or so years, and I just did one this morning to the pediatric department at a hospital, and I would say to a person, from the medical students to the residents to the practicing physicians to the chief of the department, this is what they want. They are so fed up with the current system and the obstacles that it places between them and being able to care for their patients. So I bet if we redid that poll now, it would be much higher.
Lane wants to know, how do we ensure fair treatment and coverage for all with a single payer system? Who decides what procedures and treatments are covered and for whom?
Right. So right now we have private insurance companies that make that decision, and they're not making it based on what's good for our patients. They're making it based on what they can get away not paying for. So the current system is really not working. A national improved Medicare for all takes away the private insurers, takes away that middle person, and allows patients and their health professionals to develop that relationship again where they can make the decisions. And it's because the bottom line of this system is health. The goal is to make sure that we're keeping our population as healthy as possible. Right now, with the bottom line being profit, there's a lot of money that hospitals can make off of providing services to sick people. So sadly, that's the reality. So this would take that kind of middle person out and restore that relationship between health professionals and the patients. And it creates a system that we're all in. We all get the same standard of care, whether you're low income to high income. And it creates this solidarity where we want to defend it, because you know that those at the top are going to want a good system, and that lifts all of us up if they're fighting for it too.
Linda Laurie says, I talked to friends in Canada, and you pay according to your income, yes?
So for this system, what we're putting forward is, yes, it would be a progressive source of financing where it is pegged to how much money you make.
And the way the way it is anticipated in terms of cost, that the cost of this will be a lot less than what many people are currently paying with these astronomical premiums, correct?
Absolutely. This is one of the reasons why I fight so hard for this. The United States spends more than 2 times per person per year on healthcare as other industrialized nations that cover everybody and they have better health outcomes. So we're already spending twice as much as we need to be spending on healthcare, but so much of it is going into the profits of the pharmaceutical companies or the insurance companies or into the administration. We have the most complicated system. And so if we actually spent our dollars on health, we would be able to provide high quality comprehensive care to every person and save money. And it would be an economic stimulus. People wouldn't be having to decide whether to go to the doctor or pay for their food. People would have more money in their pockets.
Christine Hartman Llewellyn says the Congress introduced HR 676, but she says that her Republican rep said that he couldn't support it because it wasn't bipartisan. Is a bipartisan bill in the works? And maybe you can explain what 676 is.
Yeah, so HR 676 is called the Expanded and Improved Medicare for All Act. It's been introduced every session since 2003 by Congressman John Conyers from Detroit, Michigan. And it was just introduced last week. Last time I checked, it had 51 members of Congress sponsoring it. So it's going to be our job. And actually, you know, back in 2009, 2010, I was meeting with both Republican and Democratic lawmakers. If the people lead, the leaders will follow of both parties. So just keep pushing on that Republican member of Congress, keep bringing the evidence. And this is what this whole campaign is about, that we're starting Health Over Profit for Everyone, is to provide those materials so people know how to impact their members of Congress and have the information to give them. So just keep pushing. This is early, but over time, we're going to see those political winds change, and then they'll be running to it.
Margaret, you have a friend, Mike Pappas, who says, hope that you're well. Hope to see you and Kevin soon.
Thank you.
And he says, it may be useful to respond to the common critique brought up by establishment liberals that say that we need to maintain the Affordable Care Act because X number of patients will die if it's repealed. I hear students at my med school bring this up all the time as a reason why we can't focus on single payer right now. How do you respond to that?
Well, justice delayed is justice denied, right? I mean, in the current system, we have almost 30 million people that have no health insurance. We have 29,000 people that died last year because of lack of access to care. I'm not advocating for a repeal of the Affordable Care Act. That's already happening, and if it doesn't happen, the Affordable Care Act is going to fail on its own merits. Right now, the fastest way that we can solve this healthcare crisis is to be pushing as strongly as we can for a system that's going to cover everybody.
Tom Dudek raises the question, will compensation for doctors and nurses change under single payer?
So it is anticipated that compensation for physicians would change. I don't anticipate that things would change very strikingly for nurses, but there's a vast disparity in incomes between primary care providers and surgical providers. And so we would probably see that some of the high-end physicians would not be making quite as much as they are right now, but they'll still be fine. And those primary care providers that are really struggling are going to see greater security, income security. And this is part of the reason why in the United States we don't have a functioning system, because we have a real lack of primary care providers. Students come out of medical school with a very high debt, and they know they're not going to be able to pay it off very easily in primary care. And so we need to reverse that and really incentivize more physicians coming into the primary care areas.
Sebastian Stroder asked the question, what will we do about how long people would have to wait to get into a hospital? Since it would be a single payer system, that would be more people going to the hospitals. We hear this quite often, Margaret, that, with these kinds of systems, that there's going to be a fall off in quality, and you have to wait to see doctors, you have to wait to go to the hospitals. What's your response?
Well, so two things. One is that, in the United States, there are tens of millions of people that can't even get into a line to go to the hospital because they don't have coverage. They would love to have a line to get into. But there's a lot of myth about these so-called lines in countries that have universal healthcare systems. People play that up to scare people away from this concept. What we see when a country makes the shift to a national universal system is that there's a change in who actually gets care. So there are people who seek too much care, and they would not be getting as much care as they maybe had been seeking in the past, because we would start to see a real triage, a real prioritization, so that people who need the care are going to be the ones that are going to be prioritized to get the care first. So it's really more of a shift of how people are seeing. It's nothing that people need to worry about.
Okay. Well, Margaret, we have about a minute left. Natalie Williams wants to, she raises the question, bringing back the right for private insurance companies to reinstitute pre-existing conditions is what worries her the most. People get hit by bills all the time and they can't cover what they need. Isn't that really the main issue with the continuation, the real danger that is if they eliminate the Affordable Care Act and we're not able to bring in a Medicare for all?
Well, I think it's important to realize that the Affordable Care Act is already failing, and that the insurance companies have been narrowing their networks of who they cover, where patients can go, and they're cutting out major medical centers and cancer centers. So people with health conditions are already struggling because where they need to go isn't necessarily covered. Again, I don't think that we should be advocating to take anything away from people, but we have this political space now, and now is the time to be fighting for this. And I hope that people will check out healthoverprofit.org, where you'll get some tools and information to help you in this fight.
You know, Margaret, that's a perfect segue because Linda Laurie wants to, she raised a question. What can we do? Should we be putting up billboards, writing our senators? And I guess when we say write our senators to say what? So what can we do right now to make a difference? And, you know, as a Green Party member and activist, what should be the role of the Green Party in this issue? We got about 20 seconds.
The Green Party is the only, well, the largest political party that supports a national improved Medicare for all. The Democrats don't and the Republicans don't. So the Greens really should be out in the forefront of this. People should be contacting their members of Congress to co-sponsor HR 676 and pushing your senator to introduce a bill in the Senate that's the same as HR 676. And then go to healthoverprofit.org and sign up there, and we'll provide you more information about what you can do.
Margaret, thank you so much. This has been a very, very informative conversation. We really appreciate your base of knowledge. And I think that it's clear now what we need to do. We've got to struggle to make this a reality. Absolutely. Thank you. Thank everybody who sent in these fantastic questions. And join us again next week where we have another conversation in these various voices from the margins. Have a good night.